Hello, my friends. I'm Dr. Anna Collins, and today I want to talk with you calmly and clearly about high blood pressure, because many people live with it quietly every day, not realizing how much it can affect their comfort, their energy, and the way they move through life. I want you to imagine that we are sitting together in a quiet room. There is no rush here, nothing you need to decide right now. This is simply a gentle conversation, the same kind I have every day with patients who want to understand their bodies a little better and feel more at ease inside them. High blood pressure is something I see very often, especially as people move through their 40s, 50s, and beyond. Many people are told they have it during a routine visit, sometimes without feeling very different at all. Others notice small changes first. They may feel more tired than they used to. They may notice headaches in the morning, or a sense of pressure in the chest or neck. Some notice swelling in the legs by the end of the day. Others simply feel that their body does not bounce back the way it once did. What is important to understand is that high blood pressure is not something that appears overnight. It usually develops slowly, quietly, over many years. And because it is often silent, it can feel confusing or even unfair when you are told you have it. Many people say to me, "I feel fine, so why is this happening to me?" That question makes a lot of sense. One of the reasons high blood pressure is so common as we age is that our blood vessels change over time. Your arteries are not rigid pipes. They are living, flexible tissues that respond to your heartbeat, your movement, your breathing, and even your emotional state. When you are younger, these vessels tend to be more elastic. They expand gently with each heartbeat and relax easily afterward. This helps blood flow smoothly and comfortably through your body. As the years go by, and as the body is exposed to things like ongoing stress, inflammation, blood sugar swings, smoking in the past, or simply the wear and tear of daily life, those vessels can begin to lose some of that softness. They may become a little stiffer. When that happens, the heart has to work a bit harder to move blood forward. Over time, the pressure inside those vessels can rise. Many people are told that high blood pressure is simply about too much fluid or too much salt. For some people, salt sensitivity does play a role, but for many others, the picture is more complex. It often has more to do with how flexible and comfortable the blood vessels are, and how well they are supported by the body as a whole. I want to pause here and say something very important. If you are taking medication for blood pressure, that does not mean you have failed in any way. It does not mean your body is broken. Medications can be very helpful for many people, especially in protecting the heart and brain, while other supportive habits are being put in place. High blood pressure is not a moral issue. It is simply a body issue, and bodies change. What I want to offer you today is a calmer, more complete way of understanding what may be happening inside your body, and some gentle, supportive habits that many people find helpful over time. Nothing here is about forcing your body or fighting it. This is about listening to it and supporting it. Many adults experience high blood pressure during a season of life when they are also caring for others, working hard, or adjusting to changes in sleep, hormones, or activity. Stress plays a quiet role here. When you are under stress, even the kind you do not always notice, your nervous system stays slightly on edge. Blood vessels tend to stay more tense. The heart beats a little faster. Over time, that constant tension can contribute to higher pressure. Sleep also matters more than many people realize. Poor sleep or very short sleep can affect the hormones that regulate blood pressure. People often tell me they wake up feeling unrested, even after a full night in bed. That feeling alone can be a clue that the body is not fully resetting itself overnight. Another factor that often comes into play is blood sugar. Even in people who have never been told they have diabetes, frequent spikes in blood sugar can quietly affect blood vessels. Over time, this can make them less comfortable and less responsive. This does not mean you need to fear food. It simply means that how and when we eat can influence how gently the body moves blood around. High blood pressure can affect daily life in subtle ways. You may notice that you get tired more quickly when walking. You may feel short of breath going upstairs. You may feel a pulsing sensation in your ears when lying down. Some people notice that their legs feel heavy at the end of the day, or that their hands feel puffy in the morning. These are small signals, but they are worth listening to. One of the most reassuring things I tell my patients is that the body is always trying to heal and rebalance. Even later in life, the body responds to care, consistency, and kindness. Supportive habits do not work overnight, but over weeks and months, they often help the body feel more at ease. Let's talk gently about a few daily routines that many adults find supportive for blood pressure and overall comfort. The first is movement, but not the kind that feels punishing or exhausting. Gentle, regular movement helps blood vessels stay responsive. Walking is one of the most supportive forms of movement there is. A calm walk, even 10 or 15 minutes at a time, encourages blood flow and signals the nervous system to relax. Many people notice that their breathing deepens naturally when they walk, and this alone can have a calming effect on blood pressure. Another helpful habit is paying attention to how you breathe throughout the day. Shallow, hurried breathing tells the body that something is wrong, even when it is not. Slower breathing, especially through the nose, sends a message of safety. Some people like to take a few moments in the morning or evening to sit quietly and breathe slowly, counting each breath. This is not about meditation perfection. It is simply about giving your nervous system a break. Eating in a more steady, predictable way can also be supportive. Large, heavy meals late at night can stress the body and interfere with sleep. Many people find that finishing their last meal a little earlier in the evening helps them sleep more deeply. During the day, meals that include protein, fiber, and natural fats tend to support more stable energy and blood sugar. This does not require strict rules. It is about noticing how your body feels after you eat. Hydration matters as well. Drinking enough water throughout the day helps the body maintain balance. Dehydration can sometimes lead the body to hold onto sodium and increase pressure. Sipping water regularly, rather than all at once, is often more comfortable. Minerals such as magnesium are another area people often ask about. Magnesium is involved in muscle relaxation, including the muscles and blood vessel walls. Many adults do not get quite enough through diet alone. Foods like leafy greens, nuts, seeds, and whole grains contain magnesium. Some people discuss supplements with their healthcare provider, especially if they experience muscle cramps or poor sleep. Emotional reassurance is just as important as physical habits. Many people carry quiet worry once they are told they have high blood pressure. They may check their readings frequently and feel anxious when the numbers change. It is helpful to remember that blood pressure naturally fluctuates throughout the day. Stress, activity, and even conversation can affect it. One reading does not define you or your health. I often remind people that healing is not about perfection. Missing a walk or having a stressful day does not undo your progress. What matters most is the overall pattern, the gentle consistency of caring for yourself. Some people find it helpful to create small rituals that make them feel grounded. This might be a cup of tea in the morning, a short stretch before bed, or a quiet moment with a book. These rituals may seem simple, but they help the nervous system settle, and that supports the heart and blood vessels more than many people realize. As we talk about all of this, I want you to know that you are not alone. Millions of adults are navigating the same concerns, often quietly. High blood pressure does not mean you are fragile. It means your body is asking for support. If you are caring for someone else, perhaps a partner or parent, it is especially important to include yourself in that care. Many caregivers put their own needs last. Over time, that can take a toll. Even small moments of rest and nourishment matter. I also want to acknowledge that information online can sometimes feel overwhelming or frightening. You may hear strong opinions or dramatic claims. It is understandable to feel confused. My goal here is not to alarm you, but to help you feel calmer and more informed, so you can make thoughtful choices alongside your healthcare team. Curiosity can be a gentle ally. You might begin to notice how your body responds to different habits. How do you feel after a walk compared to a day of sitting? How does your sleep change when you eat earlier or breathe more slowly before bed? These observations are valuable. Over time, many people notice that they feel steadier, more comfortable, and more confident in their bodies. That confidence itself reduces stress, which can support healthier blood pressure. Before we close, I want to speak directly to you if you have been feeling discouraged. If you have tried to make changes before and felt they did not help, that can be frustrating. It does not mean your body cannot respond. It may simply need a different pace or approach. Gentle changes, sustained over time, often work better than dramatic ones. Near the end of our time together, I want to invite you to take part in this community if you feel comfortable. If this conversation has helped you feel a little more at ease or informed, you might consider liking this video. It helps others find calm, supportive health guidance. If you would like to continue these gentle conversations, subscribing can keep you connected to future videos. And if you know someone who might benefit from hearing this, sharing the video can be a simple way to show care. You are also very welcome to leave a comment and share your experience or questions in a safe, supportive way. Many people find comfort in knowing they are not alone.